Paulo Mussi. I'm the director of American Academy.
My name is Dawn Schocken. I am a medical educator at the University of South Florida.
My name is Juliano Ardigo Lopes. I'm a doctor. I'm graduated from PUC Paraná.
How can we prepare or keep our professionalism during this crisis and even hope during this crisis, because actually health professions are the most affected in some areas?
You went into the profession to care for people. There is risk in caring for people. You could get stuck and get HIV. You could get measles. There's so many things you could get. Yes, you could get COVID, and yes, you could die. But you're there to provide a public service. That your mission, your passion in your heart is to provide for your patients. And the risk is there. And helping them mitigate the risk, understand what steps they can go to protect themselves. And you deal with that, and you take care of each other and provide care for each other as well.
We never thought we were going to be in a scenario like that. Never. It's when it happens, you're like, okay, what can I do? I'm here for that. I have to take the risk. Of course, in the beginning, I think we were more scared. We were kind of more worried about what was going on, what the risks we had, and we were not so prepared, I think.
What is the biggest challenge our healthcare system are facing?
From my point of view, the biggest challenge is to get our students up and running so that they're capable of managing the crisis efficiently and effectively. We didn't teach to this kind of training when they were in their undergraduate years. And so releasing them into the hospital setting without any kind of additional platform training is really, it was beyond imagination. It would be too frightening for them. It would be too frightening for our patients, and it would be too frightening for their colleagues having them come in.
The big challenge is we keep update of everything is going on, everything new we have, and how we're going to manage all this stuff is coming. Of course, we have all the problem with the health system to get all this patients inside to feel it in our health system. And the things keep changing every day.
And what kind of skills the new health professionals need to develop during their education years?
I think they need to learn much more about infectious disease. We teach a very good baseline of infectious disease, but I don't think we understand all the vectors that are involved. And this is such a unique opportunity for us to look to epidemiology to sing to us and tell us the story of how this happened and why it happened and how it went from China to California to New York in such an astronomically fast fashion. I think the other thing that we need to continue to strive is teaching resilience and teaching self-care and teaching mindfulness, because being aware of when you're at the stress point where you have to step back and say, wait a second, I need 10 minutes to cry or to emote or to scream or to do whatever, and giving yourself permission that that's okay. You're a human being. We're not robots.
What is the value of interdisciplinary learning?
We have to work like a team. And sometimes we don't see that. So when you do your education with a lot of sites and you pull all together, I think that makes you open your mind, and make you work more openly with all the persons that you are working with, no matter if it's the physician, the nurse, and everybody, because everybody is important.
If we didn't have a solid nursing team, a really good respiratory therapist team, an excellent physical therapy team, our patients wouldn't survive. They wouldn't survive just with us.
What about internationalization of education?
Information coming from all over the world. It's the communication we are having. I think I never saw something like that. So that's the positive point. We are learning a lot with that. We're doing new connections. We are having access to a lot of content we didn't have before, I think.
We've studied what came out of China, out of Italy. We've studied what came out of Spain. We're learning from what's coming out of Britain. They're teaching us so much about how to be a global nation and a global community, because they reached out right away. We're short of supplies. We need some help. We need some people to come take care of us with us. And their willingness to embrace the globe was really what helped everybody in the globe to recognize this as a global pandemic, and not just it went to one country to one country to one country.
I think the big challenge on that is learn everybody how to filter what is good, what is not, what is coming, that you really can use it for your work.
What is the truth and what is not the truth? We listen very carefully to the CDC. We listen very carefully to the NIH, which are our two big guiding forces for research. We listen very carefully to the WHO because they're sort of talking about internationally what seems to be working. I think one of the biggest messages that I try to make sure my students know, and my residents understand this, is that as you're looking at the literature, look at it through the lens of what your experience has been. So if you're going to have your patient show up and they'll have read everything on the internet and said, this is what we need to do. And you have to give them good evidence. Everything we do has to be evidence-based.
And do you think is there a value as well to insert, as I mentioned before, like a liberal education basis in the health profession?
Well, a wise historian said, if we don't know the history, we will repeat it, right? Yeah. So I think it's essential to have our physician leaders have a really both global perspective, but also a humanistic perspective. And that comes from studying liberal arts. That comes from looking at the art that's produced in these crisis times and look at the art that's produced in non-crisis times.
Do you have any advice for those young people that are going in this profession?
Just keep studying, always, never stop.
Learn about people, watch people, find a good mentor, and have that mentor help you understand what you're going into. Many people think they have dreams that, oh, this looks really cool because I saw it on TV, or my father is that, or my mother is that. You have to find a good mentor that you can relate to, that will tell you their story and help you make decisions, and then follow your dreams. You can do this, and it's going to be a long path. And people along the way will say, stop, that's not what you want to do, or this is too expensive, or we don't want to do this. But keep keep moving your passion forward and keeping your passion in front of you and chasing it, because that's what's going to help you be the best care provider you can possibly be.